Good evening. Thank you all so much for coming tonight on a Sunday evening. I really appreciate you being here. And if you're listening online, hello and welcome to you as well. So today is the second lecture of the Musicians Wellness Lecture Series. And we are going to be discussing preventing injuries. So I shared this slide in the previous lecture, and it's obviously the most recent injury data, which I found to be quite eye-opening when I learned about this particular study, and there has been other studies as well that predate this one. This is the latest as I'm aware of. And this study honed in on 8 professional orchestras in 2012. They studied about 377 musicians from professional orchestras, and 84% experienced pain or injuries that interfered with their playing abilities. 50% reported pain or injury at the time of the survey, most of which were work-related. Of those who experienced pain or injury in the past, less than 50% reported they had completely recovered. It has become clear to me that there is limited knowledge in music education in regards to injury prevention and injury recovery. So it has been one of my goals to reach out to music education teachers as well as music students. So two of the most common injuries that we see in musicians are performance-related musculoskeletal disorders, or PRMDs, which mainly impact the abilities of fine and gross motor skills. And I will give you some examples of those in just a moment. The second most common injury is related to performance anxiety, which can cause physical and psychological symptoms. Because we are going to be discussing preventing injuries, and I have an entire lecture devoted to performance anxiety on January 30th, we're going to basically stick with the PRMDs for today. Some other injuries that are possible for musicians are peripheral neuropathy, which is basically numbness or tingling sensation or burning sensation, in particular in the arms or legs. Hearing loss, dental problems, and focal dystonia. The dental problems can be related to, for instance, brass players, the overall health of the teeth, and they have to be very mindful of that. There are some other issues that are kind of grouped into dental problems, and some of that is TMJ, or temporomandibular joint disorder. I personally feel, and I have seen some data on this, but I haven't done a deep dive into this, but I believe that students who have had braces in the past generally struggle with some sort of jaw tension issues. However, the jaw muscles are also extremely strong, and they relate to our stress reactions. So there's also other components to that as well. All right, so we're going to dive into these PRMDs. So what does that even mean? Okay, well, let's start with the musculoskeletal disorders. What are those? They are injuries or disorders that affect the musculoskeletal system, which includes muscles, nerves, ligaments, tendons, discs, blood vessels, fascia, etc. Okay, and then when we add the performance-related in front of that, so performance-related musculoskeletal disorders, they are these musculoskeletal disorders that are a result of the movement, force, or other physical requirements of performance activities. So both of these terms are often referred to as repetitive stress injuries, overuse injuries, repetitive motion injuries, etc. They're all kind of labeled the same way depending on who you're talking to and what term they choose to use. So some of these common PRMDs that we have among musicians include tendinitis, which is inflammation of tendons, carpal tunnel syndrome, which means that there's compression at the carpal tunnel in the wrist, cubital tunnel syndrome, which is compression at the cubital tunnel, which is the elbow, and then thoracic outlet syndrome, which is compression at the thoracic outlet, which is in the shoulder area. Trigger finger and de Quervain's tenosynovitis, and that is basically when a tendon is moving, it moves within a sheath. There's a tendon sheath that covers that. Whenever that sheath gets inflamed, it makes it more difficult for the tendon to move freely within it, and excuse me, and it can kind of get stuck there a little bit. And so someone will be trying to move their finger and they'll go, so it just kind of moves, oh wait, it's kind of stuck, and then it'll move. De Quervain's is the same thing, except it's for the thumb, but it's the same concept. And then bursitis, which is inflammation of the bursa within joints. Okay, so let's talk a little bit about risk factors here. Now, some will have 1 or 2 or 3 or 4 of these risk factors. That does not mean that you are going to get an injury. So I just want to clarify that. Please don't get scared. But these are just some of the most recent observations that have come across in performing medicine. So usually injuries can occur or develop as a result of several of the risk factors. So the first one is gender. Generally, the females are more prone to injury. The instrument you play, and depending on the amount of perhaps force or the positioning of the instrument, can be problematic for some people. A rapid increase in practice time. I know that we've probably all experienced that at some point. Oh no, my audition's coming up. Oh no, this is coming up. I must practice a lot right now. And that can drastically increase your chances of developing an injury. If you have a previous injury, that can also spur on another injury. Poor posture. I know that we all, myself included at times, have experienced some practice sessions when we're just so tired, and we just kind of let go into it, and we just end up not using the best posture that we can, and so that can most certainly come back at us later. Overall poor health, and that can include nutrition, hydration, sleep patterns, and so on. Flexibility. If someone has hypermobile joints, they are more at risk for developing an injury because we kind of get used to allowing ourselves to use our full range of motion, but that's not always necessarily the case. And I'll talk about that in just a few minutes. And then performance anxiety and a just overall high stress level. This was something that I didn't really quite understand this issue until I got older and realized that how much I carry my stress in my body with tension. And it's something that, of course, with the performance anxiety lecture on January 30th, I will dive into that more. But if you're not in tune with your body, I highly suggest that you start trying to make some observations and notice those observations also whenever you're in a more stressful situation. Because I guarantee your body will be reacting differently. Okay, so I get asked a lot, how can I prevent getting injured? And I say some really basic things that people sometimes don't want to hear, but some of it is common sense stuff. And one thing that I do want to preface with is that there is limited data on this topic. There are recommendations by medical professionals based on the current data that we have as far as who's getting injured. But preventing is more of it's a difficult thing to study, and I'm sure that they are working on getting some more data for this, but right now, this is what we have. Okay, so the first thing that I mentioned on the last slide was rapid increase in practice time. This is one of those things. You just have to plan ahead, and you need to kind of budget your practice time, like you hopefully budget your finances as well. So you're going to know about our performances in advance, and you need to be able to structure your practice so that you're not all of a sudden having to practice 2, 3, 4 hours a day when you've taken a week or two off, if it's the summer or whatever the case might be. We need to be very aware of that increasing in practice time. Okay, so the next one, poor posture. So you need to pay attention to your posture as you play. If you feel like you're not finding the best balance or alignment for you, then you can seek somatic guidance. I talked about somatic fields in the last lecture and different options that are available to us. Poor health. Okay, this is something that you need to talk to your doctor about and determine what is the right course for you and your body. Flexibility. Just because you may have hypermobile joints, that can move in extreme patterns, doesn't mean that they should. There's different ways that you can train your joints. Like if you do have hypermobile joints, there's ways that you can train your movement so that you're not getting into that extreme movement. Okay, so the person I would first recommend seeing is a physical therapist about that, because they are very in tune to figuring out the hypermobility and addressing that. Occupational therapists could also help as well. All right, then performance anxiety and high stress level. I strongly recommend seeking healthy coping skills. We are all going to have stressful times in our lives. While we're in school, while we're out of school, while we're working, when we're trying to juggle 10,000 things, it's a stressful journey. And it's important to be willing to recognize that and seek those coping skills. Okay, so here are some other situational risk factors. So for instance, the chair. You have, most of us have no idea what our chair is going to look like, how high it's going to be, how low it's going to be. Is there a cushion? Is there not a cushion? Is it slanted? Is it not slanted? We have no idea, and sometimes we just kind of have to use whatever is provided to us. Then there's the ergonomics of an instrument, okay? Sometimes we have to play an instrument that may not be suited to our hand size or anything like that. A large instrument or a small instrument, it doesn't matter. There's different challenges for everyone. Lighting. We also have no control over lighting or the temperature of performance space or the seating arrangements. Sometimes, especially in pit orchestras, it's a really cramped space, and that can be a hindrance for some people, and they create a lot of tension because they're trying to fit into a small space. And the level of comfort or discomfort with your music colleagues, including people in your section or the conductor, anything like that, that can cause emotional stress. So here are some things that we can do. If these may be an issue for you, there are solutions to these potential problems. One, you could bring your own chair if you want to, or you can bring a cushion or a back joy, which is it's a hard plastic thing that you put in on top of the chair that helps provide a neutral pelvis, helps keep your pelvis in neutral, which can help with breathing and overall posture. And then there's also wooden blocks that you can make or possibly buy, I'm not sure, to prop up the back of the chair. I've heard some people will get like a 2x4 and then they'll cut grooves in the back, and then they'll prop the back two chair legs on that 2x4, or they'll get wooden blocks that are I don't know, maybe 4x4, have a hole in the center, and then they'll put the back two legs on top of those wooden blocks, so it props the chair up in a way that helps also prop your pelvis up in a more neutral way. All right, ergonomics of instruments. There are many different possibilities for modifications for different instruments. I know that there's, for clarinet and oboe, there's many different kinds of thumb rests and neck straps. I know for flute and saxophone, they have, Ton Koeman has some little rests for the different hands to help make it more ergonomic and free up the hand movement. For violinists and violists, they have different chin rests that can vary. And in fact, actually, I have a good friend of mine who specializes in fitting high string players with these chin rests so that it's the most ergonomic for their body, for their neck, for their shoulder, and that can immensely free up a lot of those muscles around the shoulder joint and arm. So there's a lot of different possibilities out there. I know in the brass world, there are different I know one of them is called a bullet brace, and it's basically a strong tube that you can basically rest on your hand. And so it helps kind of redistribute the weight. And so there's lots of innovative modifications out there, and I highly recommend that you explore these options for yourself. Lighting. If lighting is an issue for you, or a potential issue, you are welcome to bring your own stand light, your own music, if the color of the paper is a challenge for you, or a tablet that you can control the lighting. All of those are possibilities. The temperature of the performance space we have no control over. However, you can wear appropriate layers, especially if it's going to be, or if it's a colder facility. For cramped seating arrangements, first of all, I believe that you need to advocate for as much space as possible. Sometimes that's just simply not possible. So when it comes down to that, you need to allow yourself to acknowledge the space you do have and try not to shrink into that space. Allow yourself to be as broad as possible within the space you do have. The level of comfort or discomfort with colleagues. We have no idea what other people are thinking, and we don't want to assume that we do know. We want to make sure we're coming into a rehearsal or a performance with a healthy mind space, and remind yourself that if you're trying your hardest, if you're doing your best, that's all you can ask of yourself, and it's best to accept these truths to help yourself feel more comfortable in these situations. Okay, so I have here, wake up before you warm up. So we have been taught throughout our musical journey that we need to warm up. We need to warm up the body, we need to warm up the instrument before we practice. And there is certainly a need for that. Warming up increases the muscle temperature, the resting oxygen in uptake, and we also need to allow ourselves some time to kind of prepare the mind and the body for what we're about to do. So one of the things that I have found to make a huge difference in my own practice is before I warm up, I'll try to do some meditation or constructive rest, which is a term from Alexander technique, or just some slow breathing. Something to kind of just allow yourself to stop the hustle and bustle of the day and get yourself focused in on what you're about to do. Waking up your whole body will also enhance the body's ability and your attention in this practice session. So one of the things that I have that I like to do is I like to move around, especially before I perform in particular, but also before I practice as well. But literally moving around to me is like moving all of the joints. Now, I may look silly, but I feel more connected with my body. And when I feel more connected with my body, I feel like I can practice more efficiently and perform more efficiently. So when I say move around, I'm like shaking my arms, I'm wiggling, I might do a few squats just to kind of remind myself of all the different parts of the body. So I would encourage you to try that too. Also, just if you have some music, you're jamming out, feel free to break out and dance. Who knows, maybe someone will join you. So there is another technique that is fairly new to me. It's called emotional freedom technique. And it's basically tapping. And I know that sounds really silly, but there are some some people out there who believe that the tapping, if you're literally just tapping your skin with your fingertips, and you're just tapping your skin, and that they use this to relieve anxiety, to relieve tension as well. And so there's a colleague of mine who has her students every day before they start their choir rehearsal, she'll have them just kind of tap literally from head to toe. And they'll just kind of walk through the whole body, and they're tapping, and they take maybe 2 or 3 minutes to do this. And one thing that I have noticed in particular using this technique is it really helps kind of wake up my sense receptors. So let's say if I'm really trying to hone in on my feet, like in the connection I have with the floor, I will tap the bottom of my feet, and that kind of just allows me to feel that a little bit better whenever I'm standing. So it's something to explore, and of course I'm sure that there are many more options for this, and if you know of any or learn of any, I would love to chat with you about it. I'm always looking for more things to explore with. So those are just a few that I like to use. Okay, so then after we wake up the body and mind, then we need to warm up, of course. And one of the things that is so important, especially if you just took that time to kind of wake up the body and mind, we need to make sure that we're keeping that attention within our body throughout our practicing. So I always try to encourage my students to keep your attention on your body while you are bringing an instrument to you, if that's what you do to make music, or if you sit down at the piano bench. As you're going to play, think about how you are moving and be observant of that. Feel your breath. Your breath and breathing is a really wonderful way to check in with the body and see if there's unnecessary tension. And we can actually use the breath to help free that tension as well. As you're playing your long tones and any other warm-up exercises, make sure that you're attending to your whole body, your breath, your sound quality, embouchure, tongue placement, all those things that your teacher is telling you to do. This is the time to really spend some quality time focusing on those fundamentals, but making sure that you're also attending to the body too. As you continue through your warm-up and you're working on different studies, remind yourself constantly to bring your attention to the body, especially if you're not used to doing that. One thing that I have used a lot in my own practice, but also in my teaching, is what's called interval timers. These interval timers, you can get them as a free app on your phone, and what these do is they'll go off every so often. So you can set it for 10 minutes or 5 minutes or 3 minutes. And so every 3 minutes it will ding, and every time it dings, I'm like, oh yeah, I need to remind myself to check back in with my body. Now, that does not need to take a long time. That can literally just take a few seconds and be like, oh yeah, I need to think about my body. Okay, right. And you can even keep playing as you're doing that. It's a challenge to keep playing, but it's a challenge that is worth pursuing. Because remind yourself that when we're practicing, we need to be practicing for performances, right? And when we're on stage, there's lots of different things that can happen. People can be walking around, or a little kid could be crying, or, my son is rolling a Matchbox car down Marsh Auditorium floor. That's never happened. But there's different things that can happen in a performance that could possibly distract you. And we need to allow ourselves to practice that distraction. And so sometimes it's good to take in those things while we're practicing and make ourselves keep going too, but checking in with our body as we do that. So I also get asked a lot, should I stretch before I start playing? And that's a very good question. And ultimately, what the sports community has come down to, basically when it comes to some basic movement, is that it's actually more effective to stretch after an activity. So before the activity, you want to warm up the muscles, you want to get them going. So that means move or dance or tap or something along those lines. But then after you practice is when it's appropriate for you to do any stretches that you may want to do, and realize that if you do stretch, you want to do it gently. The movements that we generally do are not, do not require excessive strength and are fine motor skills, and especially if you have hypermobile joints, you don't want to overstretch. I one time saw someone, a clarinetist, who was sharing her injury story with me, and she was still struggling with pain. And one time I saw her, this was like before a performance, and she was doing this, but her fingers were like way back here. And I was like, at that moment, I was still a student too, but I was like, oh no, that doesn't look good. And I knew that there was something going on there. I didn't understand it until later in my life, but it's one of those things we do need to be mindful of stretching and how we're stretching, and that we're doing it after practice. Okay, so as you're practicing, continually bring the breath and the body to your attention. I've probably said that at least 10 times by now. It's just important, so bear with me as you hear it an 11th time. Take breaks often. One of the worst things that we can do for our body is to go into a practice room and then not leave for 2, 3, 4, 5 hours. That is really physically demanding and mentally demanding as well. It is imperative that we take breaks often, at the bare minimum, a 5-minute break after 25 minutes of practicing, bare minimum. And when I say break, it's a get up and move around, walk down the hallway, get some water, shake your arms out, move around, stretch out your back if you want, that kind of thing where you're not just sitting there on your phone. You want to get up and get your body moving in a different way than what you were doing to practice. Notice what types of passages can cause tension to creep into your playing. I see a lot of times when things kind of get a little technically challenging, we as clarinetists have a tendency that we want to lean forward and get closer to the music stand, and we kind of bring our arms in, different things, and everyone has different reactions to that kind of stress. Some people are more stressed with slow passages. The part that stresses you doesn't matter, it's how you're reacting to it. So if you notice that, I have a tendency that whenever things get tough, technically, I tend to really hunker down in my chair, or I tend to squeeze, or I tend to use more force with my fingers, whatever the case might be, see if you can direct yourself to change that habit. So for instance, one of the most basic things you can do is, if it is a technical passage, play it at half tempo, or less than that if you need to, and aim to play it with as little effort as possible. Remind yourself to remove judgment from your mind, and then you're like, okay, well, I'm going to speed it up and see what happens, with the idea that I'm going to keep this freedom that I have created in my body. And if you're able to do it, great. And if not, that's okay too. Maybe you need to just slowly, bring up those increments while keeping that freedom. But the freedom of muscles is the most important part. And trying to take steps to find that freedom in the most stressful parts of the music for yourself is going to be the most beneficial for you. Also, if you're able to release that tension in the practice room as you're practicing, then you have a chance at doing it on stage. I remember the first time that I was studying Alexander technique and body mapping, and my teacher asked me, so how did you feel as you were performing? And first, my reactions were always like, oh, well, I missed this note, and then my sound spread here, and I didn't like this. She was like, no, how'd your body feel? And I was like, I have no idea. Like, no idea. I can't remember anything about my body. And then I remember, the further I got along studying that material, I was on stage performing, and I was like, oh my gosh, I feel it. I feel the tension in my legs. And I was so excited after the performance. I went to her, and I told her, I was like, I felt the tension in my legs. I felt it for the first time. I felt my body as I was playing. She was like, great, could you let it go? And I was like, no, but I felt it. And to me in that moment, it was such a milestone because that was the first step in gaining control on stage for me. And I wouldn't have been able to do that if I didn't practice it. So, of course, as I continued to study the material and incorporate it into my practicing and performing, I was able to start to feel more things on stage as well as react to that, respond to it, and let go of the tension. It is still a journey for me, and I think for every musician. And when circumstances change, whether you're in one hall or another hall, or your pianist canceled at the last minute, and you're like, well, I guess I gotta go do something, and so you're winging it, or whatever the case might be, doesn't matter. What matters is if you practice that control in the practice room, you'll be able to do that on stage. So about 6 months ago or so, there was a new study done as far as retention of practice and of a learning activity. It used to be that after like an hour practice session, if you took a nap for like 15 minutes, it helped your mind reinforce everything that you just did. I was really weary to share that with my students because I was afraid they would start napping and then miss classes. So I actually found out about this new technique, and I have been wanting to share it with everyone. And so this came from Andrew Huberman, and it wasn't his study, but I learned about it from his podcast. But after you have several repetitions of a passage of music that you're trying to learn, if you literally just stop, so let's say you practice one measure and you play it 10 times, for instance, then you literally just stop and let your brain go idle for 10 seconds. That's it, 10 seconds. And you're not on your phone, you're not thinking about your to-do list or what you're going to have for lunch, you're just trying to let go of everything that's there. That 10 seconds multiplies the repetitions by 20 times. So if you do 10 reps and then you rest your brain for 10 seconds, it's as if you're doing 200 repetitions. The reason for that is because how our body learns movement, it's not by muscle memory. Muscles are not smart. Muscles can't learn. Our brain can learn. we're creating new neural pathways when we practice and we're learning music. When we do these repetitions and then we let our brain rest for 10 seconds, it's allowing our brain time to go through that neural passage way over and over and over again in a way that is equal to 20 times the repetitions that you had already done. It works. It works. I suggest that you give it a shot. If there's any shortcut to practicing, this is it. Okay. So what do you do after you practice? Okay. After working our muscles, we can gently stretch them out. Like I mentioned before, be gentle. If you do have those hypermobile joints, I would seek or consult with a physical therapist or occupational therapist so you are aware of your body's limits and what you need to limit it to. You could take a nap, like I mentioned before. You could. It would help for many different reasons, I'm sure. But it certainly wouldn't hurt as far as recovering after you practice. Ensuring proper nutrition and hydration and sleep is so incredibly important for us as musicians. Sleep allows the body to rest and the brain to reinforce the neural memory of these fine motor skills that we use so often. It will allow for restoration of your mind and body so that you can be at your peak performance for future musical activities, whether that's practicing a rehearsal or performance. Emotional health. It is so important to recognize that the mind and body are connected. When we experience emotional reactions, it actually triggers a physical reaction. So if we're experiencing some sort of trauma or micro-trauma, it does not have to be a huge, life-changing event. If someone just simply hurts your feelings, that triggers a physical reaction that what we do is we end up holding tension in a certain place, and that place can be different for everyone. Some people it's the arm structure, some people it's the lower back, some people it's the feet. It just depends on your body and how you are reacting to it. So because we have these emotional and physical reactions together, our body can create habitual physical reactions, which lead to habitual tension. When we have habitual tension, it's difficult for us to let go of that, to release the tension, and it also can hinder our agility. It can hinder our breath capacity. There's a lot of different ways that it can really affect us as musicians. And so if we allow ourselves to recognize this and address our mental and emotional health, then it will most certainly help us physically as well. And as we try to create music, think about a lot of times if we are dealing with emotional stress, we tend to kind of put up a wall, so we don't get ourselves hurt, like just an emotional wall. And if we're trying to be creative on stage and we're trying to communicate our music to the audience, if we don't allow ourselves to break that wall, it's going to be very difficult to try to communicate anything to anyone, but let alone with music. If we can allow ourselves to be vulnerable and share our artistry, our creative imagination, because we are caring for our emotional, mental state as well as our body, then that's our ultimate goal. We want to have that ability to communicate with the audience. There are, of course, several different ways in which you can do this. Some of the ones that I have suggested here are the cognitive behavioral therapy and meditation. I'm sure that there's a number more that you all can think of, and I support you all in those endeavors, and I hope that you all will take your mental health seriously as you do your physical health. Okay, so what if you experience pain? What if you experience tingling, numbness, or burning, or soreness after you practice, discoloration of the skin based on movement? So what that basically means is, if you're playing and, in particular, I have an experience, I have had thoracic outlet syndrome, so whenever I would play, my right arm would turn bright red. And then as soon as I stopped and I raised my arm up, it would turn ghostly white within seconds. And that kind of discoloration where you're like, something isn't right here. This is not normal for my skin. Feeling coldness in the fingers or weakening of grip strength. If you experience any of those, and I usually say, maybe, you just kind of overdid it, give it like a few days or a week. If it's not better within that, you really need to go see a doctor and just get it checked out. There's probably nothing major wrong. It's probably just overuse and maybe misuse. But it's important to get that checked out to make sure that you are getting that taken care of as quickly as possible. So ultimately, what I want you to do is to listen to your body. Stay in tune with your body as you practice and perform. Pun intended. If you experience any symptoms, try journaling your experience to help your healthcare professionals and yourself to find patterns. That's one thing I did not know whenever I was going through my injury, is I was so distraught about it all that I didn't want to think about it. I didn't want to document anything. I just kind of wanted a distraction. So I just did anything I could to not think about it. So when I got to the doctor's office and they were like, so what's going on? I was like, well, it hurts. And sometimes my arm changes colors, and they're looking at me like I'm crazy. And first of all, I was like, well, that might be true, but I didn't have that history documented, and I couldn't find a pattern because I didn't document anything. So there might be something that you start to recognize, and don't be afraid to talk about this with your teachers. Don't be afraid to talk about it with your colleagues. If you're hurting, these are some important things that we all need to be talking about as musicians. The location that you feel fatigue, pain, or neuropathy is important to tell doctors, but realize that if you are talking about your wrist and they start examining your shoulder, realize there's a reason for that, because a lot of the times where we are hurting is not necessarily where the place of problem is. The problem could be further away, but you're just only feeling that pain in one specific location. So recognize that as well as you're documenting and journaling your journey with this, if you ever experience this, which I hope you don't. If you feel fatigued, stop. Just let yourself take a break. Walk around. That might mean that you need to pack it up for the day, but you need to listen to your body. If you experience these symptoms, like I mentioned before, don't wait. Go see a doctor. If you would like to learn more about musicians' wellness, please come for the January 30th and April 24th lectures, in which I will be talking about performance anxiety and recovering from an injury. So I hope that you all enjoyed this presentation. Thank you all so much for being here. We're done.